So you're probably here because you're feeling really sore after a workout. Or maybe you have a family member or a friend who's coming to you and they're saying, oh my gosh, my joints are so sore. I'm aching here, I'm aching there. Or you just recently developed a nagging pain that just won't go away. In other words, you just have a pain or a discomfort or something all over or somewhere in your body that just needs some help. Well, my name is Cassie and I'm a registered nurse. I have been working in the hospital for approximately 12 years. I recently graduated with my nurse practitioner license. And as you can see, I've studied Western medicine for many years. I'm here today to share my knowledge with you and to hopefully take you on a journey to Eastern medicine, which I've had a strong interest for many years. But now that I've had time after graduation, I actually want to dive into a new area of study. So Tylenol and ibuprofen are probably two of the most common medications I always hear people say, I have a pain, I went to the store and I picked up some ibuprofen or some Tylenol for my pain. Usually the pain is like I have a headache, I have some backache, I have some knee pains, I have a tooth pain, but it's just somewhere along the body that's very specific. And these medications work because if they didn't, it wouldn't be such common knowledge to myself and everybody else that I speak to that actually takes this medication. And as for yourself, you probably have this medication in your shelf somewhere. Now, let's talk a little bit about these medications since they're so common. So, according to research and in comparison to what I've seen working with patients who do take this medication, usually the common side effects is a skin rash, they get some kidney or liver damage, and sometimes they'll have blood abnormalities. Like their blood results will come back and it will seem as they're slightly anemic or that they don't have enough blood in their body. However, from experience, if I can give you three takeaways from these medications, that would be the first one, those of you who have friends or family that have had a previous heart surgery, or it may even be yourself, you or they may be on a blood thinner. Now, because they're on a blood thinner and the blood is very thin, which means they are at a higher risk for bleeding out. If for whatever reason they get a cut or they bump their head somewhere and some of the blood vessels break, it can cause a bruise, and the bruise can become a lot bigger than it needs to be because the blood is so thin. So taking Tylenol when you're on these medications, it affects the liver. In turn, the blood thinner medication is not easily processed and excreted or let out from your body, which means that it'll build up in your system. And again, it makes the blood thinner than it needs to be. Therefore, a discussion needs to be had with your friends and family, if not yourself. The second pointer is that those of you who drink a lot of alcohol, let's say you like to have a glass of wine every night, a little bit of beer here and there, and then on the weekends you're going to dinner, you're going out with friends, and you find yourself drinking a little bit of alcohol at least like 4, 5, 6 days out of the week. Well, as you may know, alcohol can affect your liver. So if you're excessively drinking alcohol and you're taking Tylenol with a liver that's not working to its full capacity, that Tylenol can build up in your system. And if it builds up in your system, it's almost as if you're getting Tylenol poisoning. So be very mindful if you're drinking a lot of alcohol and you have some Tylenol in your shelf because you have a pain here or there. Just be extra careful because then again, you can damage your liver. The third pointer is do not take more than 3 to 3.25 grams of Tylenol a day. It used to be that back in the day, we would talk to our patients and we would tell them, do not take more than 4 grams per day because anything more than 4 grams per day can cause liver damage. There have been cases of people taking excessive amounts of Tylenol because Tylenol is actually found in a lot of over-the-counter products. So if you're taking more than 4 grams every day because you or your family member or your friends are having pains, it can build up and then eventually you may end up getting liver failure. So please be mindful, read your labels that you're not taking more than 3.25 grams of Tylenol a day. So now let's move on to ibuprofen. Ibuprofen has been known to cause thinning of the stomach lining, kidney, heart, blood, and liver damage. So in my experience, I often get patients in the clinic and in the hospital who come in and they're complaining of stomach pains, or one day they went poops and they looked in their toilet and they saw that their poop was really black. So it scared them and it prompted them to come into the clinic to get some blood work, and they found that their blood levels have actually dropped. And the reason for this is because ibuprofen, again, is known to thin the stomach lining. If you have a thin stomach lining inside, which is made of mucus, then the already very acidic stomach juice that's in your stomach, it's eventually going to cause that stomach lining to get so thin that it becomes fragile and then it could break. And then eventually you get blood seeping into your stomach. And that is the result of these patients who come and we see that they're complaining that their poop is dark and they're feeling a little bit lightheaded because their blood levels are low, we end up having to investigate. And a lot of the times they're saying to us that, yeah, they've been on ibuprofen because they had some type of pain and they were taking it so often. And eventually they had a stomach bleed. So if I could give you three takeaways with this medication, it is that one, if you already have stomach problems, for example, you've gone to the doctor and you've told your doctor that, okay, I'm having a stomach burning pain. It's really uncomfortable after I eat something. I feel like after I eat, my stomach is burning and I have to take some Pepcid and it's not going away. And then they ended up prescribing you some medication like omeprazole or Protonix to help protect the stomach. Then that is very evident that you have a history of stomach ulcers, so you need to stay away from this medication. Your stomach lining is just too sensitive and you should not be messing with ibuprofen. The second takeaway that I've also seen in the hospital, and I see doctors often discuss this with patients, and sometimes it can go missed, is that if you or your family member or friends have had heart surgery, it is advised against to take ibuprofen. The reason is because if you're already having heart surgery, it means that your circulatory system or the blood system is malfunctioning, and it's in turn affecting your kidneys, your heart, and everything along the way in the system. And because ibuprofen has been found to have negative effects on the kidney, it's going to cause a delay in recovery. So again, if you or your family member has had heart surgery, do not take this medication. Ask the doctor for an alternative. Do you hear the coyotes? Magic went to defend me. The third pointer is that you should not be taking more than 1,200 milligrams of ibuprofen a day. Usually the capsules come in about 200 milligrams, so do not take more than 5 capsules a day. Okay, so now that I've given you my expertise information on Western medicine, let's travel to the East together. So today I want to focus on turmeric. Have you heard of turmeric? So turmeric is a root that belongs in the ginger family. It was discovered about 4,000 years ago in Southeast Asia. So there are many benefits of turmeric, like gut health. Women can use it for their PMS symptoms. But as far as today's discussion, I just want to focus on pain management. So the ingredient in turmeric that's very beneficial to the body is called curcumin. Curcumin is the main ingredient that helps the body with inflammation and is an antioxidant. So let's start by going over 4 studies that I found that were very evident in that turmeric is a great pain medication. So back in 2020, they did a study with 72 older adults. These adults all had knee pain. In other words, it's called osteoarthritis. So one group was given Vaseline and the other one was given turmeric ointment. Both groups were told to apply the ointment to their kneecaps. And lo and behold, the group with the turmeric ointment actually did much better with their pain. In 2022, there was another study for 8 weeks. There was about 101 participants that all had knee pain, again, osteoarthritis. So they split the 101 persons up into 2 groups. One group was given the turmeric pill, and another one was given a sugar pill, also called the placebo. And both groups were instructed to do a 6-minute walking test. And again, lo and behold, the group that received the turmeric pill actually did much better. They were complaining of less joint pains. They were able to walk a little bit longer without feeling the discomfort. So here, it's proven that it's an effective pain management. Then there was another study back in 2023 with football players. These weren't just average football players. They were the elite football players, meaning they did a lot of physical activity. They went to practice. They were working out very, very often. And they wanted to see how well turmeric would help with the pain or the muscle recovery after long days of working out. 12 groups of the men were given turmeric, and then the other 12 were given some other drink. So you had turmeric drink and no turmeric drink. So at the end of the day, after a long workout, the blood of each player was collected and it was put under study. They were trying to look for parts in the blood that would show that the body is going through an inflammatory process or the body is going through some type of stress and your body is trying to defend itself. So these inflammatory markers are cells in your body that actually run to an area of your body that's experiencing a lot of stress. So let's just say that you're doing this very often, right? And you see this area of your joint, you're continuously doing that and stressing out that joint there. So something in your body is signaled, and then it's running here to help this area get healed because it's saying, oh my gosh, it's going through excessive movement. We need to go there. It's doing too much. So while it's going there to help or assist in the recovery of that area, there are other things that happen along the way. Those inflammatory markers will actually cause your body to do a whole other cascade of things that eventually damages this area more than it needs to. So in these football players, it was showing in their blood work that those inflammatory markers that were rushing here, there were not as much inflammatory markers. So whatever goes on here, because there's less inflammatory markers, is not as bad. Because again, more inflammatory markers means more damage to that area that it goes to assist. So with the turmeric, if there's less inflammatory markers, that means less damage to the area. So the result of this study showed that these football players experience less soreness in their muscles, less soreness in their joints. So overall, they recovered faster. Last but not least, the fourth study that I saw was a study comparing the use of turmeric and ibuprofen, and simply said, when they studied two groups using these two medications, Eastern and Western, the result was the same. Both groups have the same type of pain management. They were both equally effective. So if you ask me what I would use on my daily basis, and by no means can I make a recommendation to you so soon because I'm not your personal provider, I personally would use turmeric for any type of pain management or joint management, because on top of that, there are so many beneficial things about turmeric. Again, I didn't go over the whole list of its benefits, but just for pain management, it is working very well according to all of these evidence-based research articles. So thank you so much for tuning in to my presentation today. I hope all of the information that I presented helped you make a more informed decision about your health. I hope that you will continue to follow me in my journey to learning Eastern medicine, even though I primarily practice Western. Thank you again. Bye.